Welcome back to Open Line. I'm not going to take much time here because we have lots of callers here waiting to talk to Dr. Alex Jahangir from the Metro Health Coronavirus Task Force. She's been giving us the daily briefings every morning along with the mayor. I'm going to get right to Phyllis here. Phyllis, I know you've been on the line a long time. Go ahead with your question. Phyllis, are you with me?
Yes. Can you hear me?
I sure can. Go ahead.
Oh, good. My TV's not the same as yours. Okay, well, I only have, a converter box and an antenna to access social media right now. I just had to wonder why we're not hearing a lot of data about people that have received the flu shots and whether those that have been infected are recipients of the flu shot each year, and if they did not get the flu shot, were they more resistant? Ecuador was on the news as having a very large population of the coronavirus, and I wondered if they got a big shipment of flu shots last year, and if anybody out there has a compromised GI tract or respiratory tract. I know I do, and kombucha, which is a product, a fermented green tea, is one of the only things I found that really has helped me. And yeah, more data on flu shot related connection to corona.
Well,
Thank you.
Doctor, have you heard any connection between the two?
I haven't, and the flu shot that we give annually is not actually, it doesn't have any virus in it, so flu shot is relatively safe. I recommend everyone take it, but there's been no connection that I'm aware of between the flu shot and any of the coronaviruses.
You know, when all of this started, we would hear from the infectious disease doctors, don't take your eye off the flu. The flu is so much more deadly. You know, the flu is a big deal. That messaging has really gone away at this point. But how do the two compare, even now?
So the messaging has gone away because we're out of flu season, essentially, right? So, but I saw some data today. The rates in the winter times were about the same. The problem with the COVID virus is it has about I forgot 20 or 100 times more lethality to it. And so you're more likely to die if you get coronavirus, this specific version, so COVID-19, than if you get the flu. And so while there may be a lot of people with the flu and some people have flu vaccines and shots, you're more likely to die with this.
Well, that certainly puts it in perspective, puts it into focus. Okay, let's go to Sylvian. Sylvian, are you with me?
Yes, I am.
Great. You're welcome. Go ahead with your question.
Yes, real quick, I just wanted to thank you for, helping us out with all this information. And the question I had, Doctor, was I have personally an inoperable brain tumor, and I also have a tumor in my left lung, and so on and so on. I'm 70 years old. And my question was, there are different things that you can take to really strengthen your immune system, and I would think that if a person's immune system is pretty strong, that they wouldn't probably get the virus. And there's lots of folks like me that still go out and shop, and we do wear our mask and everything, and then there's other people that are not taking it seriously, and like they mentioned earlier, some of them are carriers and don't know that they are. So my question was, what should we take to boost up our immune system? And also, what do you think they might do with people that are just nonchalant and don't even do anything to, help others by wearing the mask when they're supposed to?
Okay, thank you, Sylvia. And we'll take the first part of that question first. From a medical perspective, what can you do to boost your immune system to stay strong during this time?
I don't have an exact specific recommendation. Other, people do say vitamin C, exercise, things like that do strengthen people's immune system. The second part of your question is a great one. Is a majority, like 40 to 50% of people who have this virus are in their 20s and 30s. Okay, so we always hear about the elderly or the immune compromised that have it who die. The majority of the people who have this virus are in that range, the 20 to 30-year-old range. Those are people who I think need to take it seriously. And I've seen, as you put it, nonchalantness when I go to the grocery store. I wear my mask, and I'm careful to try to stay 6 feet apart. They got to be taken seriously. But interesting enough, just this weekend in the New York Times, I read an article about how there is an increase in healthy 30 and 40-year-olds having strokes. So now, all of a sudden, this may be a virus that causes more blood clotting and people getting strokes. And so, I mean, gosh, I think everyone needs to take this seriously. And like you said, ma'am, and I'm sorry about everything you're going through, but gosh, we need to take care of our fellow, fellow colleagues and fellow man and really take some responsibility for everyone else.
I have to ask you, you mentioned that you are wearing your mask when you go out to the grocery. Are you wearing gloves? There's been some back and forth on whether we should wear gloves or not.
I'm not, but what I'm doing in my car, I was able to find a bottle of hand sanitizer before it all got crazy, and I had one in my car. I wash my hands a lot more than I even did before, and then as you mentioned earlier, I'm a surgeon, so I wash my hands a lot. And then but I'm not wearing gloves per se. When I see patients, I do now, where before I may have not in clinic. I'm very vigilant around my patients.
Sure. Okay. Let's get to Renee. Renee, the floor is yours. What's your question?
Hello?
Hi, Renee. Go ahead.
Yes. I'm looking at. I'm not sure if there's any updated information that's been given out. I haven't been hearing enough about the African American community, which in most states you see that the population makes up 15 to 20% of the population of African Americans. More than half of them have this coronavirus, and it's hitting the African American community hard. What are the numbers, and what is the outreach effort? I know it's not a black thing, but what is the outreach effort here in Nashville? And I'll hang up and listen.
That's a great question. Thank you for calling in. I know there are efforts to track this, doctor.
Yeah, it is. That is such a critical question. I'm so glad you brought it up. So I'm going to try this from memory. The African American population in Nashville, I think, is 27%, if I'm not mistaken. Currently, of the positives we have in Davidson County, I believe around 12 or 13% are African Americans. Of the 22 deaths that we've reported, 9 are African Americans. So what that tells me is a few things. One is, you're right, this is not a black virus, right? You would think if we test enough individuals, eventually that number of people who are infected or African American will reflect the population of African Americans in our community. So number one, we need to increase access to testing. Second, but as you see, while not statistically significant, 22 people is low to make statistical numbers around. Nearly half of our deaths are in the African American community, where only 13% of those I just told you were positive are African American. And what that tells me is as somebody who has been paying attention to this in healthcare for almost 20 years, unfortunately, it's not surprising to me that health disparities exist in our society. They've existed for hundreds of years. Excuse me. You have African American women are more likely to have deaths from labor. You have the infant mortality rate in African Americans is higher. You have higher risk of heart disease and other things. And so what that shows is African Americans and people who are medically vulnerable, or excuse me, African Americans and others, immigrant populations and others, a group that I see, are more medically vulnerable. And it's the more medically vulnerable people who get the worst impact of this disease. Now, what are we doing? I think that is something that from the get-go has been top of mind for me. Councilmember Hurt has been a great colleague in helping with this. Mayor Cooper has really been thinking about this. If you look at where we put our assessment centers, so our community assessment centers, we have 3 of them around town, one at Meharry Medical College, one in Nissan Stadium, and one in Antioch. They're open for everyone to get tests and assessments for free. So we try to be there. We try to have we're going to endeavors into communities where people may not be as likely to get tested and get people tested. Trying to do outreach. So every week I speak to Spanish media or Spanish-speaking media. We're doing more efforts to try to get to our African American immigrant populations as well and Latino population. But you're right. I mean, I'm watching this. It needs to get better, but you know, I wish it would get better in our society for everything, right? Not just this virus.
No, Renee, thank you for calling in. That was a great question. I'm glad to hear again what Metro is doing to address the issue. We do have to take a quick break. We'll take more calls right after this.